This is Dr. Stephen Rath with Fusion Medical Spa in Rath, New Mexico, and on today's talk we're going to talk about ketamine infusion therapy, the safety of ketamine infusion therapy, the audience or patient type with ketamine can be useful, and then the exact type of protocols that can be used for ketamine infusion therapy. So ketamine is an anesthetic agent. It was discovered or synthesized in 1962, so we actually have a really long safety history with ketamine. However, one of the first things when you look up ketamine in a physician drug reference about the mechanism of action, the first sentence is the exact mechanism of action is not understood. So we do understand a little bit about how it works in the brain. And the way I've found it easiest to describe to patients is that ketamine temporarily disconnects the brain spinal cord axis from the body. So we disconnect between the physical body and the psychological body. And what that does is it allows a resetting or remapping of pathways that are damaged. So this is ketamine, using ketamine not as a general anesthetic, which is how a lot of anesthesiologists have classically been trained to use ketamine. This is in much lower doses, controlled IV infusions with a pump like the one that we have behind me. We still use standard American Society of Anesthesiologists monitoring systems, but instead of using much higher doses where we're putting patients to sleep, we're actually keeping them awake. And it's the keeping them awake part that is really, really important with ketamine infusion therapy, because with general anesthesia, we're pushing the pause button on everything. We're shutting down the body, we're shutting down the brain at the same time to allow surgery to occur. Whereas when we use ketamine as an infusion, we're allowing the brain to continue functioning, but we're disconnecting the physical body. Most patients describe it as an out-of-body experience, or they can't feel like their body is still connected. So we'll see patients wiggling their arms or their legs to ground themselves and make sure that everything is still connected. But it's that temporary disconnection of that wiring that allows rewiring to occur after the infusion has completed. So a typical ketamine infusion like we do here at Fusion Medical Spa will be about an hour-long infusion. We put an IV in, we start the ketamine, it plateaus, chemical level plateaus in the bloodstream, and then once the infusion stops, it gradually tapers off. That resetting continues to occur over the next 24 to 72 hours. From the military standpoint, we don't let flyers that have had ketamine resume flight duties for 3 weeks. So that again speaks to how ketamine can continue having some reset. We've used it to treat patients with PTSD. We've used it to treat patients that were literally suicidal when they've come in the office. Used it to treat chronic depression, lots of pain issues. So all these are conditions where a resetting is very, very beneficial. The youngest patient that we've treated in the office, I want to say, was right around 10. They need to be, cognitively aware, and obviously we're not going to treat PTSD from birth trauma, although some people think that that's a true issue. But the age limit on the upper end, there really isn't one. It's safe to do in even patients that are sick. The protocol that we use is just a single ketamine infusion and then reevaluate how they're doing. All the patients that we treat, I I really address everything holistically. So instead of saying we're doing ketamine infusion therapy and we're not going to talk about diet or exercise or hormone levels, we address all of these issues and do ketamine as part of that. And I think that is what really has enabled us to treat patients with a single ketamine infusion or 2 ketamine infusions, whereas if you look at other ketamine clinics that are out there, they're talking about doing 2 ketamine infusions back to back or 5 in a week, using really high doses, keeping them for a long period of time. So I think the biggest difference in how we do it, treating everything as a whole, is probably one of the main reasons why we can get by doing many fewer infusions and still have really, really good results that are long lasting. So this is Dr. Stephen Rath of Fusion Medical Spa talking about ketamine infusion therapy. Thank you.